Good afternoon, everyone. My name's Caroline Stewart, and I'm the CEO of Ecstra Foundation. We're really excited today to be launching our Financial Wellbeing Network and hosting a webinar with a fantastic range of panellists looking at the intersection of the different domains of health that feed into financial wellbeing. We appreciate that it's a really, really busy time of the year for everybody, so thank you for taking an hour out of your day. When I introduce the panellists, you will see that lots of them have lots of live work on at the moment and reports coming out and lots of activity. So we do really thank everyone for their time. Before we kick off today, I'd like to acknowledge the traditional custodians of the lands on which we meet today. For me, it's the Gadigal people of the Eora Nation. It is a phenomenally beautiful day in Sydney and it's also 35 degrees. So we think the webinar numbers will go up today as a result of everyone wanting to be inside. But thank you for everybody joining us from across the country. We acknowledge that the ancestors past and present and the emerging leaders in First Nations community. It always was and always will be Aboriginal land. So the way we're going to run the webinar today, it is going to be a bit of a gallop because we've only got an hour and 10 minutes together and we do want to get through a lot. I'm going to explain a little bit about Ecstra and why we've decided to launch the Financial Wellbeing Network now before moving into the webinar with our panellists. So Ecstra has now been working in the area of financial capability and wellbeing for approximately 4 years. And we know that many of the people that have joined us on the webinar today are existing stakeholders, are people with great expertise and experience in financial capability, financial wellbeing, may work in financial counselling, as well as lots of new entrants or new organisations that have a much wider remit than financial capability. However, the consistent feedback that we get from a range of stakeholders is that there is currently a bit of a gap for forums where people can come together and share ideas, give some feedback on the work that they're doing, and frankly, look at policy and advocacy agendas that perhaps can help move the cause of financial capability along in Australia, as well as talking to our international peers. So on that basis, Ecstra is launching the Financial Wellbeing Network. Nothing like launching a new network just as we hit the end of November coming into December. But we certainly wanted to launch this now to give people the opportunity to reflect on the work that they've done to date, the ideas that they would like to share, and some of the networks that they would like to tap into. So the Financial Wellbeing Network, Ecstra is convening it, but it is meant to be a forum for stakeholders to connect, share expertise, ideas and insights. And the main idea is to work collaboratively to build the financial health and wellbeing of all Australians. So this is a bit of a taster event, if you like, but we really look forward to following up with people after the event to get your ideas and your feedback and suggestions for themes, topics and speakers. And while this is a webinar event, which obviously means that it's inclusive and there's more access for people, we are hoping to run a couple of in-person events over the course of 2025. It's not meant to be overly engineered, and we're certainly open to the idea of having different breakout areas based on people's ideas and interests and the areas that you're working in. Ecstra Foundation's work spans across sectors, if you like. So we work with a range of grant-seeking organisations, community organisations, government, academics, and particularly in the school education sector. We run the largest financial literacy programs face-to-face in schools across Australia. And for those of you that follow us, we have just hosted our inaugural Financial Education Forum for over 100 teachers and educators across Australia. Because as we know, there is a real gap and an opportunity around building the financial literacy capability and education of all Australians. And the panellists that are joining us today all have expertise in different areas of financial capability and wellbeing. So without further ado, I am going to close that out. There we go. And so hopefully everybody can see our guest speakers with us today. So the panel today is looking at the complex intersection of all those different health domains, be that physical, psychosocial, mental health, and a really important area that people don't often think about when it comes to financial wellbeing is environmental and climate health, and how that feeds into people's and systems' overall approach to financial capability and wellbeing. So I'd like to quickly introduce you to some of our panellists before we dive into today's discussion. And in no particular order, except for the way that it appears on my screen, I'd like to welcome Brad Ruting, who's the Senior Manager, Economics and Policy at Impact Economics and Policy. You will note that Brad is unfortunately not Angela Jackson, but as Brad gets into explaining some of the work that they're undertaking at the moment, unfortunately we've just had a bit of a clash this morning. Brad has been working in the area for over 15 years and works very closely with Angela and the team, and has been instrumental in a report that they have just launched this week around child poverty. So thank you, Brad, for stepping in and for joining us. And I'm sure that we'll learn a lot from your expertise and insights on financial wellbeing and generally the state of the Australian economy. So if we can do that in under 7 minutes, we'll be doing really well, won't we? So thanks, Brad. Secondly, we've got a great friend of Ecstra Foundation and a leader in the area of financial wellbeing for First Nations people, Phil Usher. Phil is the CEO of First Nations Foundation, and we really thank you, Phil, for taking time out from a very busy trip to Canberra to speak to us today and share your insights on financial wellbeing in First Nations communities, as well as your expertise around dealing with regional, remote and metropolitan populations. Thirdly, we're joined by Suzie Forell, who's the Research Director at Health Justice Australia. Suzie has great expertise in this area, and one of the reasons that we were really keen to invite Health Justice Australia to join us today is they work at the intersection of both the health and the medical system, the legal system, and really look at how financial stress interplays into those areas. So Suzie, welcome, and we're looking forward to your insights. And last but not least, thank you, Boon, for joining us from Mission Australia, where she's the Research and Insights Manager. Again, leading the work with Origin around youth mental health. And I know that you've got some exciting announcements and reports coming out at the moment, Bron. So thank you for taking the time to share with us your insights from the results of the very large scale and very important surveys that Mission Australia run. So I hope I've done a little bit of justice. I haven't run through your CVs, which we will include in the notes that come out after the webinar, but I'm sure participants will see that we've aimed to bring a range of experts across different areas to share their expertise and their insights on how the different domains of health really feed into financial wellbeing and what we should be doing from an Australian perspective to really integrate those and to think about the intersectionality of those issues, not just in our own work, but as we work with government and advocate for better policy outcomes for all Australians. So with those lofty ambitions for the webinar, Brad, I'm going to throw to you first in relation to, it's a really interesting time in Australia. Obviously, cost of living crisis is often mentioned. We're in a high inflation environment. We have a federal election coming up, next year. High interest rates and a range of issues that we could go through. So Brad, what we'd like to understand from you is how do you see those macroeconomic issues interplaying or feeding into the sense of individual and consumer financial wellbeing?
Thanks, Caroline, and it's great to be here and to be joining from the comfort of my own home on Wurundjeri and Bunurong land here in Melbourne. I think as we all know, the economy's been a bit up and down, and probably more down than up, particularly since the pandemic. We've seen, on the one hand, we've seen that GDP growth was quite high after the pandemic. Unemployment, I should say, reached a record low, or a near record low. But since then, those trends have been starting to unwind. And as you mentioned, the cost of living crisis. So there has been a bit of a pickup in real wages over the past year or so. But since the end of the pandemic, we've seen that consumer prices have gone up by 16%. on average, but wages have only gone up by 11% on average. And of course, these are averages, and they look quite different for different sorts of households. So I think that unfortunately, many families and households around the country are feeling like their living standards have been falling. And there's actually some new data from the OECD that was released earlier in the week that shows that they would be correct to feel that. Australia has been one of the worst performers across the whole OECD in terms of what's happening to people's living standards after tax, after inflation, and after housing costs. So what's the money people are actually left with to cover all the other essentials they have? One of the key issues for everybody, I think, at the moment is around the housing market, having some really huge impacts, which you alluded to as well. Interest rates are at their highest for about 15 years, putting a big dent in household budgets for people with a mortgage. Household debt is at near record levels, driven by largely what's been happening to house prices. And particularly really have to think about renters, who I think are doing it even tougher. At the moment, there has been, a bit of news lately around rents starting to come down a little bit, but they're still quite at astronomically high levels. So compared to the start of the pandemic, on average, rents are 36% higher, and we know that it's much higher in some of our largest cities, particularly Sydney. There was a report out, I think, also this week or last week, showing that rental affordability's hit a record low in places like Sydney and Perth, and I think also nationally. Some of the other things at the moment that are really hurting a lot of households, I want to call out childcare fees. So even though there was a big increase in the subsidies only about 18 months ago, there's still been an almost 11% increase in the fees that parents are paying. Since then, we know that a lot of women are unable to afford the amount of childcare that they'd like to have, so they can work. And we also know there's a lot of issues with childcare deserts, areas where it's just impossible to get the hours that families want. And we've actually put out a report on that. I think it was on Monday as well, if anyone wants to read more about childcare. But I think another sort of really key trend at the moment is some of the indicators around poverty, disadvantage, deprivation are looking quite alarming. So this morning, the Australian Council of Social Service put out a report with an update on some of the long-running work they've been doing in this field, and they found that, they've looked at material deprivation, where people can't afford two or more forms of essential items, and they found that there's now half of job seeker recipients living in material deprivation, a third of First Nations people, a third of single parents, and a fifth of renters. Those are pretty scary statistics. And the child poverty report, which we released with the New South Wales version of ACOS earlier in the week, found that poverty and financial strain on parents actually has a really significant impact on their children. And it's not just at the time, but it can be some lifelong impacts. So the report that we did found that in New South Wales alone, child poverty has economic costs equivalent to about $60 billion a year, which is a huge figure. It's about 7% of the state's economy. And the vast majority, about 90% of those costs, are the long-term costs that poverty and financial deprivation have on children. So it's things like lower educational attainment affects your ability to earn a good income as an adult. It's the long-term impacts on your physical and mental health. We also know financial strain in families has a really clear link to things like family violence, child protection and maltreatment issues, involvement in the youth justice system, mental health challenges. So these are really really important long-running policy issues, but the current economic environment is making a lot of them worse for a lot of people. Finally, I just want to mention as well that we have done some recent work around homelessness, and there's been a huge rise in the number of people at risk of homelessness. We've estimated about a 63% jump since between 2016 and 2022, and since then it's probably continued to get worse. And unfortunately, a lot of people experiencing homelessness are not able to get the support they need because the services we have are just stretched far beyond capacity. And I think it's the same for domestic violence services, for financial counselling services. And we've sort of got this bit of a, we've got a crisis of people not being able to make ends meet and really struggling with managing their households, but also not being able to access the help that they need.
Thanks.
Sorry if that was a bit negative, but
thanks, Brian. I think that's incredibly useful framing for the rest of our discussion today, particularly as you've provided us with that macro view, but covered off lots of different topic areas that may impact a particular cohort of consumers and a wider cohort of people than you would necessarily expect. But I think it also underscores the urgency to take a more integrated approach to what does financial well-being look like, or what are the levers that government and legislation should pull in order to look at that cross-section of it, rather than just individually thinking about one topic, which is probably a good segue into introducing Suzie and your work at Health Justice Australia. I mean, you were nodding because I'm sure a lot of the issues that Brad referenced are really live for your stakeholders and the health justice practices that you're working with. So you're working at the intersection of health, legal and other specialist services. Can you help us understand, taking that multidisciplinary approach, how do you support people with their financial, legal and health issues?
Yeah, thanks, Caroline, and just acknowledging I'm on Gadigal land as well. But yeah, so health justice partnerships really embed legal help into health and community and healthcare settings to address those legal issues that impact on health and wellbeing. And so really they just bring relevant expertise and resources together in the places that people seek help. So you're supporting common clients with those intersecting issues. And in practice, it looks like a lawyer, most commonly a community legal service lawyer, being embedded in community health settings. It could be a mental health setting, a hospital, child and family services, so going to the, as Brad was mentioning about the impact on kids and families, or a community service setting. And when we say legal issues, this could be a range of things: family violence, family law, child protection. Many partnerships deal with civil law issues like housing and tenancy, employment, then the range of financial issues, fines, credit debt, social security. And there are partnerships that focus on specific issues like elder abuse, including financial abuse. But just to go back to the rationale and connect with Brad, I guess these respond to evidence that the experience of legal need is really common, but disproportionately felt in the community by those more vulnerable to social disadvantage. It responds to the fact that legal issues tend to cluster with each other and other life issues. And I often think actually even the term legal issue is as much a perspective as we're looking at the issue as much as the experience. From a health perspective, it could look like a health issue. And we also know that those most vulnerable to experiencing legal issues are more likely to be in contact with health and community services rather than going directly to legal help. And I think, again, this may arise in the way that legal issues intersect with other life issues. And then on the health side, we've got healthcare workers telling us they don't necessarily have the knowledge, the connections or the confidence to know what to do when these things come up. So to the question of how do you deliver the support, HJPs aren't a fixed model. It's rather a strategy of working in partnerships that you adapt to suit the needs of clients, the goals of the partnering services, resources and other constraints. And while the partnerships vary considerably, some of the common things are a very intentional and active relationship between the partners, You'll regularly see a lawyer on site who can directly support clients who are referred to them by the health staff, and that might be social workers and allied health as well. In some partnerships, the lawyer's even part of the healthcare team, has a staff ID and a health email. And the lawyers are often able to join case conferencing to better coordinate some of the legal and healthcare. Importantly, you often see cross-disciplinary training, for example, the lawyer providing education sessions, but more than that, I think it's in the relationship you see support and knowledge transfer, even through things like secondary consultation, and that can be when they're on site or back in the office. And connecting back into the focus today, you often see financial counsellors working either in or with health justice partnerships. And that happens in a variety of ways. So we did a bit of a study supported by Ecstra looking at how financial issues come up in partnerships and how partnerships connect. So in some, we'll see partnerships just referring to external financial counselling services. In some, the counsellor is actually part of the partnership. So it doesn't just have to be health and legal. It could be a range of people depending on the needs of the client or the client group. And in others, the HJP might refer to the financial counsellor that's part of the existing relationship with their legal service or independent of the HJP. So that's a quick gallop. I've raced through that, recognising the time we have, Caroline. But
Thanks, Suzie. I think what you've helped illustrate very eloquently there is, there is this intersection, as you say, like a legal issue is not just seeing a lawyer about a legal issue. It's really, there's a complex interplay of multiple issues going on there. And unfortunately, lots of organisations are not resourced or funded to provide those interdisciplinary services. Organisations like Ecstra, we have a range of grant partnerships with financial capability, financial counselling. We support a range of community legal services and health services and other community organisations. But philanthropy is always just a drop in the ocean and is always just filling in a little bit of the gaps. So, the work that you do is really fundamental, and we know that quite often there's not core recurring government funding to support that work. So, thanks for explaining the interplay there. So Phil, moving on to you, who's currently in Canberra in the hot seat down there. So thanks for taking the time. First Nations Foundation, the interplay of the issues that we've talked about obviously intersects with a lot of the work that you do, as well as the very positive empowerment of First Nations rural and regional communities. I mean, what are you seeing the positive impact? I guess we've talked about the vulnerabilities today. What are the positive impacts you're seeing on overall wellbeing and health domains through your financially focused programs that really are about empowering First Nations communities? And do you see there's kind of challenges and opportunities in what we've talked about, to have a more connected, collaborative approach to financial wellbeing?
Yeah, I think for us, the financial literacy component underpins everything in those closing the gap pillars, and it seems to be overlooked a lot by government as a priority area. So I grew up in country New South Wales in Tamworth, about 4 hours from Newcastle, 6 hours from Sydney, and there was always travel if you needed the right kind of help sort of available. But once you went into specialists or needed something urgently, you're always traveling to Newcastle or Sydney. And that's as much of a financial, sort of burden or decision on a lot of communities. And to give you an idea of the magnitude, like I'm trying to get my little fella into paediatrician here. When I'm in Newcastle, I think it's a 9-month wait in Newey. Talking to friends back in Tamworth, I think they're 3 to 4 year wait to see a paediatrician. So when we look at the health aspect, what we're seeing is First Nations people starting to put money away for savings or start to build that element up, because there's more than 50% of First Nations people don't have any savings at all. And I know the measure for financial wellbeing is generally around being able to access $2,000 in emergencies, but a lot of First Nation people have zero savings. So we see building up your savings and having that sort of safety net. So if issues like that happen, they're kind of in an okay position to be able to travel to larger regional areas to access some of those services. The other aspect, which is really interesting, is around we talk about setting healthy boundaries for yourself, because there's a big thing called humbug in our community, and it's the expectation to share resources, particularly money, with family and community that aren't necessarily doing as well. And it's a real big psychological burden on a lot of people. But we talk about in our training how to set those healthy boundaries. And to give you the extremity of one example, there was a guy up in the top end of WA working in the mining sector. He was on probably 175,000 a year. And he threw that job in and went back on Centrelink because that was far less stressful than having that obligation of money not just being his, but probably going to 3, 4, 5 different family members and looking after, and that guilt of saying no, and then you're working and trying to look after yourself and your own families. We see a big change and shift where it's not can't help, but it's kind of alternate forms. It might be, making the connection to kind of emergency services that provide, food if that's what's needed, or buying groceries rather than giving cash, or just the confidence to say sort of no after a while. So we're finding that working really well, because we see a lot of this push for employment and First Nations people doing well, and if we think of wealth as sort of a continuum, we're shifting them along from left to right, but then this issue happens where they're feeling too stressed, or too guilty about earning money, or they don't have savings for an emergency, and then they quickly go back down to sort of that area of struggle, and it kind of disregards all that work that we've done to get them to that point. So we're seeing that the training is keeping more First Nations people probably consolidating the work and effort that they've done just by increasing their savings and minimizing their debt. They're allowed to access other services and build a much more, I think, what's the right word? Just that determination for themselves to spend money in their own right.
Great, thanks, Phil. I think providing those practical examples really brings to life the underlying issues that you're referring to, and we're going to pick some of those points up in our second round of questioning. And Bron, moving to you, I appreciate you have a large cohort of First Nations young people in your work, but you lead the policy and advocacy piece around with the collaboration with Origin, and your most recent report was an interview, with 19,500 young people aged 15 to 19. And it included a focus on the impact of financial stress on young people in amongst a range of other questions. And Mission Australia really has been at the forefront of those surveys and bringing them out regularly and ensuring that the voices of young people are heard, and also the evolution of some of the issues that perhaps were not on the agenda 5 to 10 years ago. So we're really interested to hear from you about how financial stress impacts young people, including mental health, and also their perceptions on the future, and bringing it back to that longitudinal piece. Has that changed over recent years, Bron?
Thanks, Caroline. So yes, youth survey data has revealed a range of impacts for young people experiencing financial stress, and changes over time. So we know that concern around financial pressures and the cost of living is increasing for young people. We ask an open-ended question in the annual youth survey around what do you think is the biggest issue facing Australia at the moment? And year on year, the number of young people talking about financial matters as a big issue is increasing. So in 2021, it was 11% of young people mentioning that. In 2022, it increased to 22%. In 2023, it was up another 10 percentage points. And the 2024 report is out tomorrow. So you may see or hear results then, but concern around finances and the cost of living is not going anywhere among teenagers from across the country. So as for the specific impacts of financial stress in the lives of young people, Dr. Kate Fillier from youth mental health organisation Origin recently led an analysis into this topic. And the report was released a couple of months ago. It was called Counting the Cost of Living. And if you Google that, you'll find the download link. The report explored different areas of a young person's life that can be impacted by financial stress. And no surprise, the analysis revealed a range of impacts, from an increased likelihood of housing instability, issues around community and social connectedness, impacts on school and work, And as you mentioned, Caroline, barriers to perceptions of barriers they face in life, and perceptions around the future being more negative. So young people with financial stress were more likely to live in unstable housing. They were more likely to report different aspects of their home as being in poor condition, comfort levels lower, less space to do things like homework. Relating to their education, we saw that they were more likely to juggle both study and work. So they reported working more hours, potentially affecting their educational outcomes and personal time. And they were also more likely to suffer from mental ill health, with symptoms of depression and anxiety higher, more likely to feel a lack of control over their future or have a negative outlook. And interestingly, young women had a higher likelihood of experiencing financial stress, as did First Nations young people, culturally and linguistically diverse young people, and those living with disability. And just one final interesting finding from that particular piece of research. We classified a young person as having financial stress if they had experienced financial hardship personally, but also if they hold deep concerns about financial security. And there was some overlap between these groups where they'd experienced both. But a really interesting finding from the research was that impact, particularly around mental health and feelings about the future, control over their life, was felt by young people who held deep concern without actually identifying personal hardship. So in an environment where more time and attention and thought is consumed by the cost of living crisis, we need to think about the impact that this is having on young people and their feelings about the future.
Thanks, Bron. That's a really sobering observation. And as I said, the value in the longitudinal nature and the annual nature of that work is really important. Just sticking with you for a minute, were there key recommendations out of that work to date around how to address the complexity of financial and other issues for young people?
Sure. So we included a range of recommendations, and I won't go through them all, but one of them was focused around the development of a national youth-focused transition passport or an app or a guide to help young people navigate financial and social services as they transition to adulthood. There was also a recommendation around the opportunity to develop more accessible online support, educational resources to provide guidance to young people, supporting the financial literacy programs and the good work of Ecstra. I didn't elaborate on this in the findings, but we know that young people with financial stress are less likely to be involved in activities like sport to integrate into their community. So, and we know how important social participation and a feeling of belonging is for wellbeing. So prioritising fundings for young people to engage with sport, artistic pursuits, other activities through reimbursement, scholarships, things like that is an important piece of the puzzle. And we know through the experience of our clients at Mission Australia that increases to income supports like Job Seeker and Youth Allowance would help young people facing financial distress to live with more dignity, be better placed to take advantage of study and other work opportunities as they come their way.
Thanks, Bron. There's some really practical and pragmatic responses there. And we know organisations like Mission Australia and ACOS that Brad referred to, and NCOS and others, are really working hard on just that base level of support to young people and other members of the community at the times that they need it. Again, I think all these issues show that there really is an opportunity to have a more connected ecosystem or a better understanding of how these different factors interplay into an overall approach to financial wellbeing. One of the things about having a national financial capability strategy, which Australia had led since 2011, is that you can have some shared goals, aspirations, and as you know, you really need to be surveying people and measuring progress and outcomes. So Brad, I'm going to throw back to you. The National Financial Capability Strategy didn't necessarily have a high profile. But in the absence of a national strategy, which is not currently active, we need to look at other measurement or other indicators to look at financial wellbeing. So the current government obviously announced the Measuring What Matters framework a little while ago, which is aiming to track the broader range of indicators, including social as well as the traditional financial and economic indicators of wellbeing. So I'm really interested in your views on the potential impact of using those kind of models to measure economic inclusion, and should more weight be given to the other health domains that we're talking about here, be that mental health? We haven't quite got to the environmental health piece yet, but do you think there's value in that, and is there opportunity?
Oh, absolutely. There's huge opportunity in doing this stuff if we do it well, and I think it is really positive to see the government putting up this framework. It will help to a degree to help us grapple a bit better with some of the issues we've talked about. But I think maybe in some ways it could have been a bit more ambitious. What is good about it is it's putting some of the indicators around health, social justice, environment at front and centre of the framing of wellbeing, and it's not just those traditional economic measures. So really good framework for thinking about policy. Great that they are funding the ABS to go out and measure some of the things where we've got gaps. Like, we do need to be making sure that we are measuring the right things, of course, but I did just want to call out, I guess, some things in the framework that we think might be improved or strengthened. And, as you're alluding to, some of the things around health and environmental health certainly could be thought about a bit more. Some of the issues we've talked about today, but particularly there's probably just a couple that seem like glaring omissions. One is poverty rates. There is no poverty rate measure in there, and there was a real opportunity here to have, a nationally consistent poverty indicator measured over time, tracked for different subgroups. It's not too late. We could still embed that, but I think that would be really key. Another big issue I'd call out is around gender equality. There's a few measures in there around things like experiences of family violence and safety, but there's, the gender pay gap's not there. That seems an obvious one to me. And we do have some really valuable measures around gendered attitudes and beliefs and how they're changing, which I think would be really important to think about wellbeing. Another issue, which is one I alluded to earlier, is around access to help and access to services. Particularly things like Phil's example, can you access the health services that you need in the area that you live in, or do you have to drive for 6 hours to Newcastle to get that care? Access to legal services, as Suzie mentioned, and access to all the other sorts of supports, financial counselling, homelessness services, etc. I think also there's some good measures already out there that could be brought to bear on these things. The ones I've mentioned, also the Economic Inclusion Advisory Committee, which was another creation of the government, has done some really fantastic work around economic inclusion, and a lot of the insights from their work could be embedded, as could a lot of the really good work that has been done over the years around closing the gap. Another thing, just to sort of mention on that note, I think closing the gap has been an interesting experience in how these frameworks fit into the broader picture. We have, pretty detailed set of targets and indicators and objectives, but as the Productivity Commission's been highlighting, progress has been pretty weak, pretty terrible on some of them. It's gone backwards on some of those measures, and there's governments making policy decisions that are inconsistent with what they've committed to under that framework. So I think for me, this shows that measuring what matters is the first step, but we need more than just indicators. We need to make sure we've actually got policies in place to improve these indicators, and then really importantly, that we are actually tracking our progress, whether or not the policies we put in place are genuinely improving those indicators, and that all of us are holding governments to account for whether or not they're doing that.
Thanks, Brad. That's incredibly helpful. And if we think about closing the gap and the way that the financial system responds to First Nations financial and economic needs, Phil, just turning to you, First Nations Foundation, you hosted the National First Nations Superannuation Super Summit, which brought like industry and community and government together to examine those issues and what could be addressed there. Are there key themes or actions that you think, when you think about First Nations community, measuring impact and working with government within the financial services sector and financial products and services, that you would want to identify as opportunities for improvement or opportunities for greater collaboration?
Yeah, I think one that wasn't specific to the Super Summit, but it gives you understanding around the structural systemic issues within superannuation is just the life expectancy and preservation age in superannuation. So to access your super, you generally have to be 60 or 65, depending if you're still working full time or not. And the life expectancy for First Nations people is around 71. So that automatically makes it really hard for First Nations people to want to engage in the superannuation sector. And even comparing those age differences, it's not the same kind of quality of life you're having a 65-year-old Aboriginal person to a non-Aboriginal person. And to put it in perspective, it'd be like telling the rest of Australia you couldn't access superannuation until you're kind of 75. And I think we'd see a really massive disengagement broadly in the sector. So that's a structural issue that makes it difficult. And during the COVID early access to super, we did a SNAP research piece on our people that we've trained, and we'd found 40% of First Nations people had accessed the whole $20,000 for the early release. And the real interesting part of the story was not necessarily that they needed it, but they thought it was the only time that they'd actually get to access their superannuation. So First Nation people accessing super early is one of those significant issues. There's a few things we have at the moment with government. One around deceased estates seems like a simple fix, but that's never the case in law reform. So the struggle is if your partner passes away and you don't know what super fund they were with, the ATO holds all information on everyone's super. You can't call up the ATO to find out what super company they were with, even though they have that information. They won't tell you. So we've got these estates for people that have passed away and not knowing which super company they were with. So we're trying to get that legislation change where ATO can just reveal what super company your partner might have had super with, and then you can go through the identification and process and all that kind of paperwork as well. Other parts we're exploring Indigenous kinship structures when we're looking at estate planning, who might actually be entitled to funds and who's receiving it is a bit of an issue in community. So we're doing a deep dive into that to look at some of those challenges and making a recommendation on one, either changing legislation or just a framework for decision makers to understand and consider. And then we go to the ones that aren't really legislative but more industry focused, but things like superannuation companies asking whether their members want to identify as First Nations or not. It'll give us a really good indication around some of the behaviours. We were doing appeared before a Parliament inquiry a couple of months ago, and one of the senators said, in her community, First Nations women are accessing super at a far greater rate than anyone else, and asked if we had a perspective. And I said, we have no idea, because no super company will ask whether they're members of First Nations, so we can't really pinpoint that data and that information, which would give us a really good story. So we're navigating the data sovereignty and the legalities of that as well. But they're probably some of the core issues that we're focusing on and that came out of that First Nations Super Summit.
Thanks, Phil. That's a really good summary, and again underpins that importance about being able to collect the data, ask the questions, and to be able to measure the work that you're doing and the outcomes there. Thank you, Bron. I'm just switching back to you, because obviously collecting data and measuring outcomes is really important in your work. A slight change of gear from talking about financial products and services into climate justice, climate change, and environmental issues, and the way that feeds into financial stress, or the perceptions of financial well-being for young people. What makes young people particularly vulnerable to that environmental stress, and how do you see that interplaying with perceptions or actual financial well-being?
Sure. So we recently collaborated across two reports led by Dr. Caroline Gao from Origin that explores the different impacts that climate change and extreme weather events is having on our young people. So the first analysis was conducted off the back of 2022 youth survey data, where issues relating to the environment and climate change was listed by just over half of young people as the most important issue facing Australia. So to contextualise that result, if you can cast your mind back a few years, this was off the back of the 2019-20 Black Summer bushfires, then widespread flooding over the next couple of years. So there was widespread acknowledgement around young people about the issue of climate change and concerns about that. We also asked a question around personal concern for climate change, and results revealed that young people with high levels of climate change concern were more likely to report to have impacts to their well-being. So to have concerns around coping with stress, they were more likely to say they had poor mental health, have negative outlooks about the future. As a follow-up to this research, Dr. Gao led an analysis into the impact of extreme weather events. So in 2023, 13% of young people indicated that they'd been directly impacted by extreme weather events, and we saw impacts to young people's financial security, as well as education, well-being, access to essential services. Some young people too were more vulnerable to these weather events, like young people from lower socioeconomic areas. We asked an open-ended question around how young people were impacted by these events, and financial strain was mentioned frequently. So it was due to income loss in the family. People spoke about property repair expenses and unemployment. Some people spoke about short-term financial challenges, and others, particularly those coming from areas impacted by drought, had longer-lasting effects from financial impacts. So of the 13% who had experienced extreme weather events, 60% reported impact to their broader community, with 40% direct household impact. And unsurprisingly, that direct household impact led to more severe experiences of, housing challenge, financial hardships. They were twice as high compared to their unaffected peers. All this to say, young people were able to identify a variety of resources and supports that helped them cope in the aftermath. So it wasn't all doom and gloom. Young people spoke about community cooperation. Many young people spoke to communities coming together to provide support to one another, providing financial support, families, friends, community groups, and organisations being a really important piece of the puzzle for them, as well as staying hopeful, preparing for future weather events, and leaning on those supports.
Thanks, Bron. That's an excellent framing of the issues, but also, I guess, some of the mitigations and some of the support structures that are available. And I think also your points show the real importance of partnerships and people working together to provide people with access to those resources, because sometimes it's not so much that the resources are not available, it's just the access and inclusion and people knowing where to go at the times they need that support. So Suzie, I'm just going to throw back to you, because obviously partnership is a really important part of Health Justice Australia. If anything, you know, the name of your organisation kind of gives that away, that you work in a really collaborative sense. So you've got some research underway to assess what is an effective partnership in the health justice space. So without giving too much away, you know, what are some of the practical outcomes you're seeing there, and what do you think are the elements that contribute to a successful partnership approach? Because obviously that's one of the overarching themes of us launching the Financial Wellbeing Network is, you know, what are the opportunities for partnership there? Thanks, Suzie.
No worries, Caroline. Yeah, look, I guess the first thing I'd ask is, well, what do we mean by success and for whom? So we're clearly interested in the difference that partnering or partnered services make to clients, but we're also really curious about the difference it makes to the practitioners and the service systems as they seek to provide holistic care. So for clients, a range of outcomes, I guess I'd say we're really curious about wellbeing, recognising that activity in one sector like health legal can have impact in health, and so just having a broad enough understanding of wellbeing to recognise impact outside your direct stream of activity, and I think that's a really helpful way to think about it. So yeah, support with financial issues will impact mental health, as we've already heard. And in terms of systems, I'd say we see HJPs offering improvements to the capacity of services by bringing a range of skills and resources together, and also the capability because of the opportunity to learn from each other. And we see those as really critical outcomes to look at because they're the foundation to client outcomes. And so useful to think about also as interim. So what contributes to effective HJP? I'd say an effective partnership generally invests in its foundation. Spending time on building what's appropriate for your clients, what's feasible in the setting and with your partners. And I guess one of those foundations is a really clear and shared purpose for the work together. And that in turn needs to be informed by a clear understanding of the needs and the gaps that you aim to address with the partnership. So we've been doing some work with new partnerships, doing sort of legal needs assessment that looks at the types of legal issues likely to arise in certain settings, but also looks at, if you like, the legal capability of the staff. So that's not just skills and knowledge, it's the confidence and trust, because both of those inform the opportunity to build a partnership. We always suggest having a clear understanding of why each of you is partnering, what you each bring to the partnership and what you seek from each other. And then there's all the really practical things about what you might need to partner, such as resources, physical space and governance. And we've got resources on the HJA website that go to that called building blocks. But the other thing I'd say is also the time to build that knowledge and trust of staff who may be working in partnership. And I guess it's become evident to us the importance of digging into how comfortable staff are to work with lawyers, given what their experiences and assumptions might be about the law and about lawyers. So you've got to kind of build that understanding and trust before referrals and relationship are going to flow. We often get asked about co-location of services. Obviously, that's really valuable in terms of being available to people in settings where they're accessing, but it's not always, certainly doesn't need to be full-time. It may not be necessary, and it's certainly not sufficient. You can have co-located services or even integrated services that share a workplace, but kind of work like have parallel play. We can see it with kids, so not actually connecting. So what we'd say is important is relationship, trust, connection that enable services to build a collaborative approach and then provide that trusted connection to clients. In the multi-site evaluation that you alluded to before, what we're doing at the moment is really trying to dig into some of those core features so we can then assess them against outcomes. And I guess the other one that's really come up from the lawyers involved is the importance of the remit, which is the space, the time, the flexibility and the resources both to build the partnership and work in a trauma-informed and holistic way to meet the needs of clients. So that might be timeframes that need to be really quick in some issues, but also long when people need more time because of all the other issues in their life.
Thanks, Suzie. You've covered an enormous array of, what an effective partnership looks like and all the elements that go into that. And without reducing it too much, one of the key points there is time and trust. I think time and trust, and quite often partnerships don't get the time, the trust, the funding, and the environment. It all takes time, as you know, and particularly funding cycles can be too short. And when you're looking at co-location of services or individual services, it's quite often taking that pie and having to divide it into where can you put the funding into the resources where you think you're going to get the most impact with not enough resources to go around. So thank you for bringing a positive framing to what potential partnerships could look like. I'm a little bit conscious of time, and I'm in lots of trouble with the extra moderators behind the scene because I failed to mention that we did have a Q&A section there, and a few people have made some comments there. Thank you, Paul Holmes from Legal Aid, who always provides some thoughtful feedback and is offering to work with you, Suzie, on a health tax justice partnership. So there you go. There is a question in here, and it is a really important one, and we haven't touched on it. And I know organisations like the Smith family are looking at it, and that's digital inclusion. And, what does digital inclusion mean in the sense of overall well-being for people, including not just in finances and availability of products and services, but what does a digitally inclusive environment mean for people's overall health and well-being? Brad, is that an area that you've looked at in your work to date?
Not to a great degree, but I think in a way, digital inclusion is very important for people to, feel connected, to, help them to access, the financial services, to help them to manage their household affairs. But in a way, digital exclusion is kind of the bigger problem. And sometimes I think, we live nice lives in Sydney or Melbourne or Canberra or wherever we are, and we don't stop to think that there are huge numbers of people who don't have access to digital services because, they can't afford the technology, they don't know how to use it, or simply they live in a remote area where it's just not accessible, like particularly for a lot of First Nations remote communities. So yeah, it's a pretty broad issue, and we're certainly seeing that with the move to the cashless economy and the continued closing of rural and regional bank branches. Phil, is that an issue that you've seen in the communities that you visit or work with?
In terms of the branch closures or the digital sort of access?
Both. Sorry, don't mean to reduce the digital inclusion to bank closures and online banking.
The digital exclusion one's really interesting because we hear about it being excluded digitally from, financial services, and that is a big part of it. But we'll also go out to community and they'll be trading crypto, and they'll have sports bet accounts. And, I think romance scams are one of the biggest for First Nations people. So I'm trying to question whether it's the usability of a financial service provider, or if it's a exclusion, or what sort of the case is, because we're in Palm Island and trading crypto was a massive thing that they did there. But it's also one of the areas that's down for digital exclusion. So we're very much in a curious sort of research stage to see what the actual issue is.
Oh, that's such an interesting observation, and also segmenting that by different age brackets, I think, is also quite interesting. And even in our financial education summit last week, crypto and digital assets, sorry, nothing to do with necessarily digital inclusion, was coming up as a huge issue, along with other issues such as scams, as you would expect. Bronwyn, switching to you, there's a specific question on the Q&A asking about your report's findings. It's a big question, given the time that we've got left, but in terms of strategies and policies targeting young people, without preempting the launch of your latest report tomorrow, do you see the report findings shaping broader organisational policies and strategies for you and, nationally?
Yeah, so the report is really about bringing, front and center the voices, the opinions, the experiences of young people in Australia. So it's certainly an important report internally, and it's utilised by services from across the organisation around, program development and how best to engage with young people in their local area. But the report findings, they are cited nationally and internationally, so really have a very broad reach in, just raising, those that voice of a young person to the fore.
Great, thanks, Bron. So I'd like to throw open to the panel now. We've given everyone kind of the opportunity to talk about some of the issues that they're seeing within their own work and more broadly. But if you think about the overarching theme here, which is building financial well-being for Australians, now and into the future, just invite you to make some observations about perhaps what you would like to see changed, opportunities to work with other organisations. Obviously, there's a federal election coming up early next year, and this is a certainly safe space that's being recorded and put on YouTube. But, so now's a great opportunity to share your observations around that, perhaps questions that we haven't asked or responded to as we do a wrap up coming up to 5 minutes past, and we've got about 8 minutes to explore that. So Brad, on our run sheet, we did have a big hairy question there for you around the federal election on the horizon and changes in leadership globally, but I think given the time that could be a little bit broad. So in that remit of financial wellbeing and the interplay between each of the domains, are there issues that you think that we should be tackling or policy areas that we should be focusing on?
There's loads, because I think to tackle financial wellbeing, we do have to be quite broad and quite ambitious in our thinking. And for me, financial wellbeing is much more than, access to services or financial capability. It's also things like having enough money to get by and to survive. It's things like having opportunities in life to succeed. So I just think, a lot of what we're seeing at the moment around, a lot of the issues, and I'm particularly fascinated with Bron's research around the young people and experiences of financial stress and not feeling like they've got control over their lives. Like, I think in a way that's kind of symptomatic of what a lot of people are feeling across Australia and the rest of the developed world, driven by all the macro factors and other developments I mentioned at the beginning. So, policy-wise, I think, it would be great if our politicians did have a bit of vision and a bit of, a plan for how they're going to deliver on that vision. And I would like to see things like a real focus on inclusive growth, economic inclusion. How can we have a productive and successful economy, but also in a way that, younger generations are not going to continue feeling like they've been done over and that they're going to end up worse off than their parents. And, related to that, is our safety net still fit for purpose? Are we properly protecting people in society? Because we know social insurance is not really working. Half of people on JobSeeker can't afford basic essentials. So that's pretty bad. We don't have properly universal childcare. Medicare's falling apart, doesn't cover dentistry. All the issues around homelessness and family violence, access to legal aid, all the complex help. Like we've discussed a lot of these things, and I think these all sort of need a really careful look at through how can we make sure that we have a safety net that's going to actually do its job. So that's sort of it, in a nutshell, the impact economics and policy centre wish list.
Yeah, thanks, Brad. And we'll be sharing some links after the webinar. I mean, Impact Economics has put out a lot of policy papers and partnership reports in the last little while, which really reiterate the importance of ensuring that there is a safety net, and that ensuring that people experiencing vulnerability at particular points in their lives in Australia that is generally prosperous is just not acceptable. So, Brad, thanks very much for that summary. Who would like to go next? Phil, have you got some observations that you'd like to share with us?
Well, off the top of my head, given we're in Canberra for this reason, one of the balances for us is starting to shift the conversation for First Nations people from social to economic. We find if we keep having that social policy conversation, we don't really progress too far, and that's around viewing us as a deficit, and there's certainly space for that. It's needed. There's a lot of vulnerability and struggle in the community, but we're wanting to shift that to an economic conversation where, what happens if we get this right for First Nations people? What are First Nations businesses, where business owners are financially literate, contributing to the community? And at the moment, it's something like $16 billion a year, and massive workforce. There's over 100,000 people are employed by Indigenous businesses, and given that we're sort of a younger demographic, might be just under 50% of us are under the age of 25. What's that mean for superannuation when on the other side of things there's an aging population and there's going to be a drawdown on superannuation, but First Nations people are kind of building up the asset pool. So we're really looking to shift the conversation from social to economic, and also make sure that it's everyone's business. It just doesn't get caught up in the Indigenous affairs space, but where it's appropriate, Treasury doing what they need to, and Health are doing what they need to, and it doesn't kind of get just lumped into the Indigenous affairs portfolio because it's got the word Indigenous in it.
Thanks very much, Phil. That's a long list to prosecute, and I know you and First Nations Foundation and many of your partners really are elevating those many messages. It's incredibly slow and difficult work, but we commend you on your leadership to date, and also the positive energy that you continue to bring to that. Bronwyn, turning to you for the looking at young people and the work that you've been doing with Origin and Mission Australia generally, did you have some wrap-up observations for us through your work around that overall wellbeing domain?
So I'll just refer to our partnership. Well, we're a partner in the ACOS and UNSW Poverty and Equality Partnership, which many people on the call will be familiar with. There are over 3 million people in Australia living below the poverty line, which will come as no surprise to many of you. With wealth inequality a growing issue, particularly for young people, I guess in the lead up to the next election, we will be advocating for adjustments to some of those financial and support structures. They'll kind of form our focus for advocacy. So around income support, rent assistance, more social and affordable housing.
It always comes back to housing, doesn't it, Bron? As a key issue. Thank you for those observations, and we're really looking forward to your ongoing work in this area. Suzie, over to you for some final observations on your incredibly complex work and really important work.
Oh, look, I'm listening to the fellow speakers and just recognising that it's those fundamental things, as Brad pointed out, that are necessary rather than waiting to the end when legal problems are arising. So I just really back in what others have said. I guess in terms of the partnering space, we also think about what's the scope for collaborative advocacy around that shared goal of improved wellbeing. And as everyone said, recognising that wellbeing is the business right across sectors. And that's where we all actually connect. And so I guess that's a curiosity for us about how we really encourage and support collaborative advocacy support across sectors. We've done that recently there's a new national partnership agreement by really connecting with our health colleagues to have them also speak about the value of legal help to the health of people and taking that to politicians as well. So again, that to remove that sort of siloed activity that only health activity has health outcomes, etc. So I guess that's an area we're really curious to keep prosecuting.
Thanks, Suzie. I think that's a really good exploration of the value of partnerships across sectors. So I'm just going to wrap up on time. I've taken pages of copious notes here, but I hope for the participants, the panelists, and the people tuning in, this has just been a bit of a taster of the many issues that you can throw into the blender and hopefully, examine more closely. Well, I can't do that in a blender, but once you throw all those issues in together, you can see the interconnectedness between them and really the opportunity for organisations and people to be talking to each other more, talking about the areas that they're working in, their specific projects, but also what they're interested in other areas, which is specifically why we invited each of these speakers to join us today, because they have a particular area of interest but are working across sectors. So we were never going to solve the issue of building financial wellbeing for all Australians in the space of the first hour and 15. But hopefully it gives you a bit of a sense of the possibility, the opportunity to collaborate more, to explore these issues, and really to come together to take a more coordinated approach to this, because there are huge, complex issues to address. And each organisation can't do it in silos. So there are many opportunities to collaborate, but frankly, in Australia, there's really not that many opportunities to come together to talk about financial wellbeing and capability and the bits that feed into it. So by Ecstra convening the Financial Wellbeing Network, we're not claiming the space. We just want to create an environment and an opportunity for organisations and people to come together to talk. So after this event, we'll be sending out a follow-up email for ideas and suggestions for 2025. If you've got specific questions for the speakers that you didn't get an opportunity to ask today, or you're looking at opportunities to work with each of those, please send them in to us and we'll share them on. So on behalf of everyone, I'd like to thank our speakers today. So to Bronwyn, Suzie, Phil and Brad, we really appreciate your time and your thoughtful observations. To the Ecstra team that put the webinar together behind the scenes for us, I really appreciate it. I wish you all the best for the rest of 2024, and we look forward to working with you all in 2025. Enjoy the rest of your week, and thank you very much.